Good afternoon, everyone. Happy Sunday. Good afternoon.
Hi, Professor. I'm trying to figure out where I'm gonna type instead of speaking.
Oh, no problem. You don't see the chat box?
Looking for it.
Okay. Hi, happy Sunday.
Hello, how are you?
Good, and you?
Doing well. How's your weekend so far?
So far, so good. It's raining today.
I know it's raining bad by me too.
Here in Florida, yes. So we'll just give everybody a couple minutes before we get started, okay? You guys are going to be the nurses that come to your shift a little early just to get the good patients.
That's true.
It's always good at the beginning because you get to check your patients, you get to check your charts and make sure everything's going well.
Agree.
Okay, good, Patricia. I'm glad you found it. Um, no, Patricia, the topic tonight will be going over NGN question types and the grading. So I'll be breaking down how it's set up, the number of questions, the types of questions, and how they're graded. And we're actually going to do a case study. So different topic. So we're going to go ahead and get started. Can everyone hear me okay? Hopefully you can. Okay, perfect. Okay, good. Just wanted to make sure. So we're going to be focusing, of course, on test taking strategies, right? So again, what we're learning today is not only to pass our exams and for NCLEX, but it's to make sure too that all the information that you're gathering is to make sure that you're going to be a knowledgeable nurse, right? So that's why we call it everyday nursing. And of course, it's with me, Dr. M. So again, happy Sunday. So we're going to get right into it. Now, the basics are going to be very, very important, okay, for all of you. So just make sure you know what type of learner you are. Are you a visual learner, right? Do you have to sit in front of the class, see everything? Okay. Are you an auditory learner? Do you like to go back and play different things? Are you a kinesthetic learner? Do you have to draw pictures and highlight? right? These are going to be very, very important because this is how you're going to maximize your attention and, of course, your studying. And I know it's very hard sometimes, but even trying to read prior to coming to class before the lecture is going to be very, very helpful to you. Or even for those, of course, who are going through and making sure, of course, that they're going through and prepping for NCLEX, right? You want to make sure that you're very, very comfortable, right, with the content, right? So even if you don't read the whole chapter, look at the bolded words, look at the objective section. That's really going to help you, okay? In addition to that, you can make sure that you focus on utilizing your learning style in class, okay? If you can go ahead and mute yourself, I'd really appreciate that, okay? So again, making sure that you're comfortable, right? And practicing questions soon after class or after the content is delivered. That's of course going to help with retention and maximizing those particular things, okay? In addition to that, you want to make sure that everything that I'm talking about, you use it as soon as possible, right? It's just, this is really about taking what you have been doing so far and really learning how to make it work and be better for yourselves. But one of the basic things that I found with nursing students is that you need to learn how you learn best. Okay. And everybody's different. You might be all three, but you need to get very comfortable with your learning styles. Okay. So again, make sure you know if you're a visual learner, right? So again, sitting in front, sketching, writing out your notes in different colors, auditory, listening to things over and over, right? And kinesthetic, right? Drawing things, modules, physical comfort is important for you, okay? So again, just make sure you're comfortable with your learning style. And remember, part of successful test taking strategy is making sure that you have a positive attitude, right? Again, stinking thinking will get you nowhere. Okay. So start with a positive attitude. Don't get overwhelmed by the material. This is all about making sure that you feel comfortable with what you know. So again, no negative talk, only positive words, okay? So gracious words are like a honeycomb, sweetness to the soul and health to the body, right? So again, you want to be cultivating a positive environment in your mental space. That's going to be very, very important. I really think it's a game changer for nursing students, especially when you guys are in school, you're prepping for boards. You have to make sure that, again, you're your biggest motivator. So the biggest thing that we're going to talk about that I see, of course, students might have potential issues with, of course, is how do I prepare? How do I get started, right? What am I going to do, right? Depending on where you are, especially with the different courses, or if you're prepping, of course, to take your boards. So the biggest thing I say is, of course, at the beginning, okay, you want to make sure that you're going to be well prepared. What's going on a second? Hold on one. Okay, so we'll continue, right? So we talked about the visual learners, right? And the biggest thing too is making sure that you guys go through that and you're comfortable. So I'm going to go through and pick up exactly where we left off. Okay. Now that really incorporates developing a good studying plan, right? Being prepared. Okay. So good time management is going to be very, very important for you. Okay. So again, between clinicals and classes and so on and so forth, you need to know when you study the best. Do you study best in the morning? Do you study best at night? Okay. And create a calendar. Okay. Just like you would if you were going to work. Okay, you don't want to miss a shift, right? Usually not until you're sick or you have some type of emergency or extenuating circumstances. It's going to be very, very important that you stick to your calendar. You make notes. Okay, I'm going to study every morning from 5 to 6. Okay, that's going to be very, very important, right? Strategy. Okay, preparation is key. Also, quality versus quantity. I see a lot of students that, spend 12 hours studying, and then you ask them questions related to what they studied, they can't answer you, right? So again, it's better that you're really prepared and you're focused on that little bit of time, right? So again, if you know you have an hour to dedicate, right? And it's quality studying, right? You know you're getting the material in, you're retaining it, you're repeating it. That's going to do you better than 5 hours of just going, going, and going, and you're not comprehending anything, right? And making sure you have what you need, your computer, a question and answer book, or whatever resource you're using, and also a special notebook. Okay. The notebook is going to be very, very important because this is where you're going to keep special notes, your laundry list, okay, of all the things that you don't know. And does anybody know the minimum number of questions most nursing students do before they sit for boards right after they graduate? Anybody take a guess?
85.
85 questions. Now, not the minimum that you get on the test. That's the minimum you get on the test. Everybody's aiming for that, right? But again, just the number of questions after students graduate up until they take their boards. How many questions do you think the average is? 100, 500, 1,000? Okay, I'm seeing 300, 100, 200, 250. Okay. It's a minimum of 10,000 questions. The average, yes, 10,000 questions from nursing school until they take their boards. That's a lot of questions, right? So again, that says minimum, they're doing 200 questions a day, right? So again, it's not about just yourself, right? Most of you probably don't even get in 20 questions a day, but are you getting something in to reinforce the content, reinforce the material, right? So again, you really have to strategize and really focus on making sure that you get this study plan together for yourself, your calendar, again, looking at it and dedicating your time to it. Just like you will when they give you a schedule that you know you have to be at work, show up for yourself when you study as well, okay? So, what is the one of the most important components of NCLEX and nursing exams? What are we trying to find out? What is NCLEX trying to do when it's trying to give you a license?
Evaluate if you're a safe nurse.
You got it, right? The NCLEX-RN exam is designed really to see if you can critically think, right? Are you going to be safe to practice? That's really what it's focusing on, to see if you're going to be safe to practice. Okay, it's a safety exam. They know you're not going to know everything. They know you're not going to see everything, so on and so forth. But again, if I give you this license, can I depend on you to save someone's life? Okay. And remember, just a few things, right? Again, the nursing exams, right, and the NCLEX are difficult because the questions ask you to make judgments and apply information, not just to recall facts, right? Can you make a decision? Can you critically think, right? So again, no matter how hard you study or how much you can recall, you will not pass, right, or get your license, which is essentially why you're in nursing school, right? Unless you can use the knowledge to make good nursing judgment, good nursing decisions, okay? So if you're really serious about passing your classes in NCLEX, right, repetition and thorough preparation is a process that rewards you, not only with good grades and the knowledge, but of course, those of you who need to make sure that you're passing, okay? Just please make sure you put yourself on mute so that way everybody can hear. Thank you. Okay. And again, succeeding on any examination is within reach, right? But again, you have to be interested in learning the material, right? You have to create a positive culture, right? You have to learn the material. Before you guys start doing questions, do you know the content? The biggest issue I see is that nursing students don't know the content, but they jump to the questions. And then, but if you jump to the questions and you don't have a thorough understanding of the content, it's really wasting your time. Master the content. When you've mastered the content, you can answer any question. Okay, using some of the test taking strategies that we'll be getting through today. Content first and test taking strategies. Those are really the key to passing your exams and ultimately, of course, passing NCLEX. Okay, and making sure that you read. Okay, we're going to learn the different parts of a question. And when we look at test taking strategy, right, reading is key, right? And understanding, looking at why something is happening as you study. Okay, asking questions is very, very important. Why is this happening? Why is this lab value going up? Why is this person showing this signs and symptoms? Okay, this is how you develop critical thinking. Okay, now, a lot of your nursing exams, and of course, NCLEX is based on Bloom's taxonomy, right? It looks at nursing education and the objectives that we focus on, right? And nursing is really based on these Bloom taxonomy on this type, okay? All of the questions fall into Bloom's taxonomy: knowledge, comprehension, application, and analysis, okay, are the cognitive levels, and they all reflect the 4 types of questions that you see on exams and of course on NCLEX, okay? The items that are application and analysis level are more difficult and require critical thinking to answer, okay? So the NCLEX works and nursing questions work off of Bloom taxonomy, okay? So the biggest thing too that you guys need to have basic is knowledge, okay? So that's the content, okay? Then we look at comprehension, right? Do you understand the material? And then the application analysis questions that you see here are the only ones that count for you to get a license. So do you see how it builds up? So again, you have to have the knowledge, you have to have the comprehension, right? In order to apply and analyze the information. So what we do, we provide safe nursing care. So all of your nursing questions and boards uses the nursing process. We look at Maslow. We look at if you're going to be a caring nurse. We look at how you communicate. We look at the teaching, learning that you do for patients. Again, are you culturally competent, right? Do you provide that spiritual based care, right? All of these are put into your test questions. Now, everybody should be familiar with the nursing process, right? Again, assessment, diagnosing, planning, implementation, and of course, evaluation. Now, it used to be known, of course, as ADPI. You're going to see sometimes that it's referred to as AAPIE. I always say always apple pie, right? That's kind of how I'm thinking about it. So they're just changing that diagnosis part, of course, to analysis, right? So the first part of the nursing process, when you guys take health assessment, right, is to assess, right? We always assess first, right? And you're going to look for keywords in the questions, right? If it asks certain things like first, best, initial, priority things, you're looking at what the assessment is asking you to do, or if you're missing that, okay? And we always want to validate that type of data. And then we're going to look at the different signs and the symptoms, right? And we're going to identify clients' priority needs. And we identify priority by airway, breathing, and circulation, okay? And then when we identify those things, we're going to put a plan together. That plan is what I implement, okay? So of course, if it's something that requires a doctor's order, like medication, if it's something that I can do, right? I'm going to do something, okay? I have to assess first before I can do something, right? That's a big test taking strategy, right? Do I need more information? Do I need more assessment, or can I implement? Okay. And then the last part is the evaluation, right? When we look at the patient outcomes, right? And part of that, of course, will include the documentation. So the biggest part too, when it comes to nursing, right? You want to make sure, right, that you document when the patient is stable, okay? And you've assessed and you've implemented, right? Because again, me sitting down means that I have no emergencies, okay? That my patient doesn't have any emergencies. Is everybody clear on that, right? Because when we're documenting, we're not doing anything for the patient. Okay, so you have to be careful of documentation answers because it's really considered a do nothing answer, but we only pick it if we've done everything else. Okay, so again, your patient has to be stable, you've implemented, you've assessed, and then you can sit down and, of course, document. And remember, part of nursing NCLEX questions, right? Do not take anything you have seen in clinicals, okay, for your patients. This is a glass house scenario. Every exam, the NCLEX, right, is based on a glass house theory, okay? You have all the resources and all the time you need to answer that question and to be with that patient. It is set up to be a perfect medical world and a perfect medical model. Okay. So again, do not take anything you see in clinical practice, so on, so forth. This is a glass house. Everything is perfect in our exams, in our medical world. Okay. So remember that. So we're going to look at the different parts of a question, right? When you guys are looking at questions, okay, you want to make sure that you look at this different thing. So this is the parts of a multiple choice question. There's the case scenario, the STEM, and usually it's followed by 4 answer choices, okay? So the case scenario is a description of the patient and what is happening, okay? The STEM is the critical part you need to pay attention to. That's the part of the question that asks you the question you need to answer, okay? Now, the distractors are incorrect, but often feasible answer choices. I know some of you on exams, so on and so forth, oh, they all look right, okay? But only one of them answers my STEM. So that's what you need to know how to understand. So let's do an example, okay? So the case scenario, a patient who is visibly upset says to the nurse, I want to talk with the head nurse. No, get me the supervisor and the director of nursing and the owner of the hospital. I'm mad. That's my case scenario. The STEM is my question. Okay. The best initial response for the nurse to make is based on that case scenario. Is it A, whom do you wish to see first? B, don't be angry. C, why do you want to talk to them when I can help? Or D, you seem upset. Which one would you guys pick? You can put it in the chat. Okay, I'm seeing a lot of A's. Okay, I'm seeing a lot of A's. Okay, so this is critically important. This is part of test taking strategy. Okay, so we're going to go through this together. The correct answer is actually D. You seem upset. Okay, so what you want to do is, of course, in the case scenario, the patient tells you, right, they want to see everybody under the moon, right, in the hospital, and they're upset. Okay, so we're going to go through some test taking strategies. A does not promote communication and does not allow exploration and understanding of the issue for the patient. Okay, whom do you see first? Okay, what you guys just did, part of test taking strategy, is you pass the buck. You gave this to somebody else. You just told NCLEX, I don't want to deal with this. I'm going to just give it to the charge nurse, the director, whoever. okay? You did not take the time to see if you can fix the problem. So part of test taking is to understand the test is about you getting a license, okay? They don't want to see you, we call it passing the buck, okay? What are you going to do, okay? And of course, B, when we look at B, don't be angry. Can I tell anybody how to feel? Can I tell somebody how to feel? No, I can't. Okay. You're going to go through and start learning process of elimination. Okay. I can't tell anybody how to feel. And A, I'm not going to pass the buck. So I'm eliminating A, I'm eliminating B, and C is considered what? Confrontational. Whenever you see WHY in an answer, don't pick it. It's confrontational. Why do you want to talk to them? I can help you. Why? Never choose why answers. Okay, they're wrong. So you can see by process of elimination, and this is one of NCLEX's best way to see how you communicate with patients. It's called paraphrasing. I love these types of questions. I just say back what they just told me. You seem upset. Yes, I'm upset. My food was cold. The nurse came in, turned on all the lights, right? Do you see how you can get the patient to talk? And then you can do what? You can fix the problem. You acknowledge their feelings. You promote communication. Okay, so this is how you use test-taking strategies. Yeah, it makes sense. But you see how you've kind of fallen into that trap of, oh, they asked for somebody, I'm going to go and get them. No, what are you going to do to fix it? Well, let me warm up your lunch. Okay, let me see what I can do. Okay, I'm sorry about that. I'll pass it on to the night shift that you just want them to knock. They just have to check on you, but I'll ask them not to turn on the lights. Okay, does that make sense? I solved the problem. Okay, so that's just part of how we use test-taking strategies, okay? So when you read these questions, make sure you understand what the question is telling you, right? What is the question asking you? Who is the patient in the question? Are there any key words that I need to pay attention to in the question? And what is the issue in the question, okay? So again, what is the question telling me? What is the question asking me, okay? And look at the STEM. Because remember, your answer has to match the STEM, okay? And second, make sure you understand who is the focus of the question, okay? You must be able to identify the client in the question because again, the answer usually relates to who? Whoever the client is, okay? And remember, the client is not always the patient. Sometimes it's a family member. So let's do a different type of question. A nurse will be going on vacation. To involve the patient in the excitement, what is the best thing the nurse should say? A, let me tell you about the plans for my vacation. B, tell me about some of your past vacations. C, I'll bring the brochures for you to see. Or D, what do you think about vacations? And remember on NCLEX, you have to pick one to get to the next question. Okay, I'm seeing some B's, I'm seeing some C's, some D's, okay. So A, I'm glad nobody picked A, right? Remember, questions are never about who? You. Now, even though you look at the STEM, right, to involve the patient in the excitement, it's always about the patient. They're always the focus. They're always the client, right? It's not about you, okay? So you're not going to tell them about the plans for their vacation, okay? So we eliminate that, right? And let's look at B. Tell me about some of your past vacations. What did I assume about that patient? Did I make an assumption?
Yes, that they went on vacations when you don't
Yes.
know anything about them.
Exactly. Yes. But you see how you can fall into that? Unless the case scenario tells you, don't add it. You guys tend to pick things that wasn't even said. And it's very easy to do. I made an assumption. Remember, we don't make assumptions. We never assume anything, okay? We go by what is said. We go by what we see, right? Those objective things. So if the case scenario didn't tell you, it's not an option, okay? And we never assume. These are very important test taking strategies. So this question is teaching you, it's never about you. And we don't make assumptions. If it's not said in the case scenario, we can't assume, okay? And see, I'll bring brochures for you to see, right? We don't time travel on NCLEX. NCLEX is based and questions are based on here and now, right here, right now. How do I know I'm going to have time to go on vacation and the patient's going to be there when I get there, right? It doesn't really make any sense. So you can see by process of elimination, when you learn test taking strategy, A is wrong, B is wrong, C is wrong, right? D could have been written in Chinese. It's right. Okay. So that's how you want to start eliminating. You want to start looking at test taking strategies, right? And then I love that answer. You know why I love D? What do you think about vacations, right? I flipped it, right? And it turns out that I'm including who? The patient, right? And then what if the patient says, I hate vacations? I don't want to talk about vacations. What do? What would you do? You leave it at that. Yes. And you move on. But what about that? What about that Super Bowl? Right? You change the subject, right? And remember, as nurses, you're going to have to do what? Communicate, right? But you have to learn what your patient likes to talk about, what they don't like to talk about, right? You talk about something else, you move on, right? You always make it about your patient, right? And the topics that you talk about are stuff that they want to talk about, okay? So hopefully that made some sense. Okay. Now, the other thing you want to pay attention to, especially for your boards, okay, especially for questions, you want to make sure that you pay attention to key words, underline them, circle them. They need to start popping out at you. Okay. So the important phrases or words in a question, right? Early, okay? Early versus late, okay? Those are very important things that I want to pay attention to, okay? Also, immediately, right? Again, when I see words like immediately, right, that means I need to do something right here, right now, okay? And then I look at different words, most likely, least likely, initial, after several days, okay? So again, if a patient's just coming from surgery, right, and it's an early finding, right, I have time to do something, right? If something is a late finding, it could potentially mean that they're closer to dying, right? I acted too late, okay? Again, I look at, is it, again, just after surgery, after several days, okay? So I need to know what are the emergent things that I pay attention to after a particular surgery, okay? Because if it's a long time after the surgery, they've kind of cleared that emergency complication period, okay? And then, of course, when you look at the question, you have to know what the issue is. Sometimes the case scenario, especially when you guys are going to get case studies, right, which we'll be doing later on, okay, for the NGN question types, right? They provide a lot of information, okay? So you need to know what the issue is that it's asking you to answer, okay? The specific problem or subject. Is it asking you about a drug, a toxic effect, a disorder, the problem, the behavior, a procedure, okay, like a biopsy, cardiac cath? You need to start paying attention and focusing on what it's asking you, okay? So again, your new habits that you need to start developing, cover up the answers, read each answer individually, make sure that you're able to eliminate answer choices. Why is this wrong? Why am I keeping this choice? Okay, mark out the ones for sure that are incorrect. Because if you can get it down to 50-50 with multiple choice questions, your brain is going to just focus on those two instead of all four answer choices. Okay, so you put question marks to the ones that you narrow them down to, right? Those are your maybes. Okay, so let's look at a question. Okay, We're going to look at the reality and who it's talking about in the question. A client is admitted to the hospital for an exploratory laparotomy. The client's daughter says to the nurse, I wish I could stay with my father, but I need to go home and see how my children are doing. I really hate to leave my father alone at this time. The best nursing response is. So what's my STEM? What is it asking me? You can put it in the chat. You can
What the best response the nurse should give?
Exactly. So you have your case scenario, right? So the case scenario is that the client's daughter says that I wish she could stay with her father, and he just had an exploratory laparotomy, right? The best nursing response is. So based on that case scenario, what are you going to say to her? Okay. Is it one, your father needs opportunities to be independent? This will help him become self-sufficient. Is it two, your father is capable of taking care of himself? Try allowing him more independence? Is it three, stress is not good for your father at this time? Perhaps you can call your children. Or four, you are feeling concerned for both your father and your children. Let me know when you're leaving and I'll stay with him. Okay, I see a lot of fours. Okay, good. Okay. Now that's how you use test taking strategies. Okay. If you look at answer choices 1, 2, and 3, they all talk about who? Yeah, the patient.
The father, the patient.
Exactly. But was I asking you about the father?
No.
No. So by process of elimination, when you learn test taking strategies, 1 is wrong, 2 is wrong, 3 is wrong. Do you see how you're usually left with the right answer? Because you know who I was talking about. Okay. So again, it's not about the father, it was about the daughter in the question. So again, your answer has to match what they asked you. Okay. So eliminate the ones that don't. Good job with that one. Okay. So of course, distractors are incorrect options that are designed to resemble the correct answers. They are intended to distract you from answering correctly, right? So that's how you really need to develop these test taking strategies. Read your answers, cross out your nose, get it down to 50-50. Okay. And make sure you don't misread the test questions. Make sure you read them carefully so you understand what is being asked. Do not overlook keywords. Sometimes during the test, oh, I missed that word. I missed first. I missed priority. I missed bright red. Okay. Again, don't read into the question. Everything that you need to answer the question is there for you. Again, we don't make assumptions and don't incorrectly misinterpret a disorder. So a common one that people might get confused is diabetes mellitus with diabetes insipidus. 2 different disease processes, right? So you want to make sure you understand what is being asked. So again, helpful tips to avoid reading into the question. Restate the question in your own words. Eliminate options that include new information. Remember, if it's not given to you, if it's not said, don't pick it. Sometimes I make up answers, diseases on quizzes, and people pick them. I don't know what that is. I made it up. Okay, but it sounds bad, so you pick it. Don't do that. Okay. And of course, eliminate everything that requires you to make assumptions. It's very, very important that you develop these helpful tips. Okay. So again, we often hear, and I often hear from students, that you get it down to 2 answers and you always pick the wrong one. Okay. So if you're left with 2 answers and can't make a decision, go with your gut. Okay. Use a selection procedure that allows you to make educated guesses based on the skills that you're learning. Look at the case scenario. Look at the STEM, okay? Because you have that 50-50 chance, okay? Pay attention. Did what I pick answer the question? Did I pick the best one, okay, out of these two that answered the question, okay? And go back and make sure that it did that. So we're going to look at the different types of questions, okay, that you guys need to make sure that you master, okay? So the difficulty levels. Remember, a test question is doing one of two things, okay? Again, on your nursing exams and on NCLEX, testing to see what you know. That's just, remember, part of Bloom's taxonomy, knowledge and comprehension. Those questions don't help you get a license. Testing to see that you know how to use what you know is what's going to get you a license, right? That's the application, that's the analysis part that we need to pay attention to, okay? Being able to use what you know. So let's pay attention to this, okay? So knowledge, remember, is the lowest cognitive level, okay? So again, it's just asking you to recall information that you should have memorized, okay? So let's look at this one, lab results. The nurse is evaluating a client's lab results. Which lab value is of concern to the nurse? And oh my goodness, it's to select all that apply. Is it one, lithium of 0.9 milliequivalents per liter, theophylline 30 micrograms per milliliter, a BUN of 30 milligrams per deciliter, serum creatinine 0.9 milligrams per deciliter, or a potassium level of 2.5 milliequivalents per liter? So remember, this is a select all that apply, right? And the test taking strategy for select all that applies is what? True or false. True or false, okay? To what it's asking you, the STEM, okay? So when I do select all that applies, this is the strategies you need to use. Is it true or false? I would be concerned about that lithium level. Is it true or false? I would be concerned about that theophylline level. Is it true or false? I would be concerned about that BUN. Is it true or false? I would be concerned about the creatinine. Is it true or false? I would be concerned about the potassium. So I see some mixed answers. I see 2, I see 3, 5s, okay? If this was a group test, I think y'all can make it, okay? So theophylline, BUN, potassium, right? Those are the ones that concern me, okay? Again, it was asking you which is of concern to you, okay? And remember, if you found this question to be difficult, that was a knowledge question. This is a question on NCLEX that doesn't even count for you to get a license. It's a basic level question. So if this is an issue for you, please stop, okay? And you need to make sure that you start doing what with your farm? Taking it more what? Seriously, right? We push the pills to pay the bills, right? Very important, okay? So you need to make sure that you're comfortable and you need to start creating a laundry list, okay? We don't like when the laundry piles up, but in this particular case, you need to start keeping in your notebook stuff you don't know, and you need to make cards, okay? If you don't know drug levels, you need to make your cards. If you don't know therapeutic levels, you need to make your cards. If you don't know your labs, you need to make your cards, okay? You should make time and know all of your lab values. All of this, your serum electrolytes, your potassium, magnesium, calcium, chloride, your ABGs, okay? Your pH, your CO2, your bicarb, your CBC, hemoglobin, hematocrit, platelets, your blood lipids, my triglyceride, my lipid panels, my anticoagulation therapies, PT, PTT, INR, my liver function tests, right? Remember, medication only leaves the body two ways, either through my kidneys, which are 80% of drugs, or through my liver, which is 20% of drugs. Okay, so I need to know what my ALT is, what my AST is. I need to know my renal functions, right? BUN creatinine. and the therapeutic medication levels, digoxin, theophylline, lithium, your blood glucose levels, right? And of course, your basic metric conversions, milligrams to grams. You know, you're going to get, you can potentially get medication questions. Okay. So again, by the time you get ready for boards, you need to know all of these, even though you'll be given a reference now on your NGN NCLEX. Okay. You need to know them, and you need to know them well. Like all of you know your cell phone numbers. It's tax time right now. Everybody wants a refund check. Like you know your social security numbers and your kids' social security numbers to get a big refund check. Okay. You need to commit these to memory. You need to make sure you have your flashcards. I know it's not Dollar Tree anymore. It's a $1.25 tree. Okay. You can get a pack of 100 for $1.25. Invest in yourselves. These are things you need to be looking at every single day. Okay. Everyone clear? Good. Okay. So level 2 is a comprehension question. Okay. So this requires that you have an understanding of written communication and information, vocabulary words, and that you understand some of the things they're talking about. Okay. So this again is a level 2 question. It doesn't count for you to get a license. I'm seeing what you know. Okay. A client is placed on a low residue diet due to a diagnosis of Crohn's disease. Which of the following foods should the nurse include in the dietary instructions for this client? Okay, is it 1, baked chicken and mashed potatoes, 2, tacos and taco chips, 3, lettuce, salad, and apples, 4, whole grain toast and cornflakes? Don't be shy. Remember, on board, you got to answer the question to get to the next one, right? So again, this is just about growing and learning. If you got this on your boards, what would you pick? Okay, I see a couple 1s and I see a couple 3s. Okay. So this type of question requires for you to focus on what keyword. What keyword here is going to help you answer this question? What do you need to know? What vocab word from this do you need to know that's in the case scenario? Low residue, right? So again, if you don't know what a low residue diet is, do you think you're going to get the question right? No, right? And diets are very, very important. Okay. I probably will do a little series on all the diets you need to know for board. So again, I'll probably just record that so you guys can have it. Okay. But it's important. I need to know what a low residue diet is to answer this question, right? A low residue diet is a diet designed to reduce the frequency and volume of stools, right? While prolonging that intestinal transit time, that peristalsis. It's very similar to a low fiber diet. Low residue is pretty much like a low fiber diet. Okay. These patients have to avoid raw fruits, except bananas and vegetables, nothing with seeds, no whole grains. Okay. So it's the opposite of a high fiber diet. Okay. So you can see how the knowledge and comprehension questions, this is how your NCLEX gets longer. This is how it can go from 85 questions to 86 to 87, because every time you get a question wrong, your test gets longer. Because it's like, oh, let me see what you know. Let me keep poking. Okay, I have to find the holes, right? And by the time you guys get done, you won't have any holes, right? We're going to prepare for 150 and pray for 85, but we always prepare to take the whole thing. Just prepare like it's a 150 question test. Okay. So again, this shows you the difference between knowledge and comprehensions. Those two questions don't give you a license on boards. But sometimes students have a lot of trouble with just the knowledge and comprehension questions, right? So again, the knowledge questions are just facts. Comprehension means you have to understand the significance of those facts. So again, we're going to look at application. Okay, application, right? You have to be able to take it up a notch. right? To answer application questions, these are the ones that count for boards, okay? You must apply concepts you learned previously to concrete situations. You must show them that you can link information together. Linking shows you're critically thinking, okay? So let's look at this question again. A client is diagnosed with Crohn's disease. Which of the following foods should the nurse include in the dietary instructions for this client? Is it baked chicken and mashed potatoes, tacos and taco chips, lettuce, salad, and apples, whole grain toast, and cornflakes? Yeah, you got it now, right? Not going to change, right? But if you look at the difference between the comprehension question and the application question, what word did it leave out? Did it tell you low residue diet? Right. So this is application. It's showing that you already should know that a patient with Crohn's disease, one of their biggest issue is what? Diarrhea, right? Do I want them eating foods that are high in fiber? No, I want a low residue diet. So it's showing them that you can link, that you can think, because you're showing me that you already know without me telling you that the patient needs a low residue diet. So you can see how they can go from a comprehension question to an application question. The application question means you have baseline what? Knowledge. You have background knowledge to answer the question. So this is a type of question you want to get right. When you study, especially GI, you guys know GI, right? It's about moving, right? All my intestine, small intestine, large intestine, my gallbladder, all of these things, diarrhea, constipation, right? You need to make sure that you are able, okay, to know the difference, especially GI. You need to know diets. You need to know signs and symptoms, okay? So again, put this on your laundry list. If you don't know Crohn's disease, you don't know diets, especially low residue, okay? You need to be very, very comfortable, okay? So again, Crohn's disease is an inflammation of the bowels. Usually the patient has these signs and symptoms: abdominal pain, diarrhea, weight loss, fever, fatigue. And this is an age group that happens between 20 and 40 years old, okay? So it's so important to know the teaching, the diet, okay? And what should be avoided. Again, a low residue diet should avoid raw fruits, vegetables, and whole grains, right? Put that on your laundry list if you don't know it. Okay, knowledge questions. Again, basic questions. Let's see if you guys can get this one right. Okay, challenge yourself. The first step of the procedure for making an unoccupied bed is A, pulling the curtain, B, washing your hands, C, collecting the linen, or D, placing the bottom sheet. I'm proud. I'm proud. I'm very, very proud. Yes. I don't care what procedure it gives you. The first step of any and all procedures is always what? Hand hygiene. I love hand hygiene questions. Love them, love them, love them. Okay? Basic principles. Don't get caught up in a, do I place the sheet? Do I put the bottom sheet? I don't care. That's not, what is the first step? Keyword, first step. Straight, very simple, very straightforward. Good knowledge question. Okay? So comprehension, let's step it up a notch, okay? To evaluate the therapeutic effect of a cathartic, the nurse should assess the patient for A, increase in urinary output, B, a decrease in anxiety, C, a bowel movement, or D, pain relief. Now, farm is going to be a very big part, always going to be a big part, okay? I know some of you are in different parts and haven't taken farm yet, right? But this is going to help you study and get ready for it, okay? You have to learn what medications do, okay? And you have to learn keywords, Okay. So the therapeutic effect, right? When you study medications, why do I give blood pressure meds? It's to make the blood pressures go down. That's the therapeutic effect, is why do I give a medication? Okay, why? Okay, so this is also showing me if you know your classes of medication. Okay, so I saw a lot of B's. Okay, the answer is actually C, a bowel movement. If it said laxatives, you would have picked it. It used the other word for laxative, which is a cathartic. And I know some people probably were thinking catharsis, relaxing, so on and so forth. No, no, no. You're showing me you know your classes. Diuretics increase urinary output, right? Anxiolytics decrease anxiety, not cathartics. Like my PAMs, diazepam, right? So actually, a cathartic is a very potent laxative, a very strong laxative, okay? That stimulates the bowel and increases peristalsis that will give the patient a bowel movement, okay? And for pain relief, of course, it's analgesics. So you can see how when you know certain things, it helps you get the answer right, especially with pharm, okay? Especially with pharm. You want to make sure you learn your medications by classes. And this one didn't even name any meds. It just gave you classes, therapeutic. Okay. So again, just basic comprehension question. So again, the difference between knowledge and comprehension is that you have to have the knowledge, right? Which is just facts. Comprehension, you have to know the significance of those facts. Okay. So let's look at application questions. So these are the type of questions you want to get right on boards. A client is experiencing a hypoglycemic reaction. The nurse should administer which of the following items to best treat the reaction? Is it 1, water, 2, diet soda, 3, milk, or 4, 1 sugar-free cookie? So remember, this is an application question. I want to get this right, okay? It's showing I can put 2 and 2 together. I'm linking, it's showing I'm thinking, okay? I see some mixed answers. See some 2s, some 3s, some 4s. All right, nobody picked water. So it's actually 3, right? So the key thing is you're asked to do an intervention, right? You're asked to do an intervention. And right, it said sugar-free. The patient's hypoglycemic. That means their blood sugar's what? Below what? Below 60. They low. When they're low, they can hit the flow. That's what I say. Yes. Right? So you need to understand, 1, hypoglycemia, right? And what do I give? How do I intervene? Okay? Because the assessment already told me that they're low. Okay? And remember, diabetes is a disease of carbohydrates, not just sugar. A lot of people think it's just sugar. It's carbs. Carbs. Okay? So my choices here, right? Water doesn't have anything to bring that blood sugar up. Diet soda, if you look at the back of a diet soda can, and remember, test taking strategy, just generally speaking, do I want to give anybody soda on boards or on test questions? Is soda ever a good option? No, right? No soda. But diet soda doesn't have anything. If you look at the back, it says 0, 0, 0, 0, 0, right? So again, if I eliminate 1, I eliminate 2, I'm stuck with milk and a sugar-free cookie, right? How many of you were looking for orange juice? And orange juice ain't here. Okay. So again, I got to look at my options. I have to show them. Yeah, you see how sometimes I don't give you what you want, right? So you got to think your way through this. Okay. Sugar-free, not me, right? It doesn't have what I need. Okay. The only option here, and it's full of carbs, is milk. That's actually going to help raise that blood sugar. Okay. So remember, when you're looking at things, right, it's not just important to know basic blood sugar values, right? The range. But what does it mean? What does the patient look like when they're hypoglycemic? Okay. What do I do? What are my options? So when you study, that's how you need to look at it. Okay. What do I do? What are the numbers? What are the signs and symptoms? And what are my options to fix the problem? Okay. So of course, you already know diabetes is going to be all over your boards, all over your comprehensive exams. Okay. Especially in the last term. So you need to have a firm grasp and understanding. If you got this question right, you're on your way to getting a license. Okay. If you didn't, it's okay. You fix it now. Make a laundry list. Make your laundry list. Okay. So analysis questions, right? Biggest thing too with this one, they want to see that you know, understand, and you can apply the information. All of you are going to get this on boards, this type of question. Okay. The nurse administers 10 units of regular insulin at 7 a.m. You must know your military time to a client with type 1 diabetes mellitus. The nurse monitors the client closely for a hypoglycemic reaction during which time frame? Is it 9 to 10, 1300 to 1900, 0900 to 1500, or 1100 to 1200? So again, for those of you who may not have taken pharm yet, okay, or don't have a firm grasp, insulin, right, is very, very important. There's a peak time for insulin, right? When insulin is peaking, meaning that's when it's the strongest, it's the most potent, right? That's when it drops my blood sugar the most. And this is something that a lot of students struggle with. They're insulins. You can't struggle with insulins when you're going to go take boards. If you want that license, you have to master insulin. You have to know the onset, the peak, and the duration. I really care about the peak. When that medication is the strongest, it's the most potent, it's going to drop that what? That blood sugar. And I need to know the type of insulin. Is it short acting, long acting, intermediate? Okay. One, good. Analysis. You're required to consider and examine possibly several concepts in this question to answer it correctly. Okay. In this question, it's necessary to know that regular insulin is short-acting insulin. It peaks in 2 to 3 hours. And that is when you're going to see a hypoglycemic reaction. I'm looking for peak. When is it the strongest? Not onset, peak. So regular insulin, again, peaks in 2 to 3 hours. And remember, what type of diabetic was it? Type 1. They rely on what type of insulin? Regular. This is the highest level of question you want to get right on boards. This is top. This is analysis. You're working your way through. You're showing them you can critically think. You know when to look for when the patient could potentially drop. And you're assessing. You know when to look. That's what I'm testing here. Based on the medication, the type of patient. Okay, do you know when to go assess them and look for a hypoglycemic reaction? So again, if it's something that is an area of weakness, put it on your laundry list. When you get to pharm, if you haven't already, or if you're in pharm, insulin is one of those top drugs you need to be very familiar with. Remember, it takes 2 nurses to give insulin. Okay, very high risk drug. So when we look at different things, okay, the different types of questions, right? Again, knowledge, right? Just even if we take blood pressure, right? You need to know what normal blood pressure is, right? 120 over 80, right? What are some things that can make blood pressure go up and make blood pressure go down? Patients bleeding, they're dehydrated, if they're hypervolemic, up and down. That's just basic comprehension and knowledge. When is a situation, yeah, fluids, that would make me take a blood pressure? When do I want to take a blood pressure? When a patient's complaining of chest pain, if they're showing signs and symptoms of dehydration, right? That's application. You not only understand the blood pressure, you know when to take one, even though something is happening. Okay. And you determine which situation has the highest priority if blood pressure becomes an issue. Again, if it's an hypertensive crisis, if the patient's having a stroke, okay, that's how they test you. So let's focus on a couple more things before we conclude. So this is an example taken directly from one of the 8 client needs categories on boards, okay? It's under safety and infection control. Remember, you need to be above the passing standard on all 8 sections to get a license, right? And good, Zania, before giving narcotics. So this is a question. Let's see how you guys can answer this one. An emergency room nurse receives a telephone call from the police department and is told that several victims involved in a train accident will be brought to the emergency department. The nurse's immediate action is to, 1, call as many nurses as possible at home to have them come to the hospital to care for victims. 2, follow the directions outlined in the hospital's disaster preparedness plan, emergency response plan. 3, ask the housekeeping and laundry department to deliver an extra cart of linen that contains several blankets. 4, call the operating room and inform the staff that they may receive numerous victims that require surgery. We see a lot of 2s. Good. So again, it is 2, right? This is what we know a test taking strategy as the global response, where one answer does all of the rest. This is a global response, okay? One action will take care of all the others. If you look at number 2, right, as soon as I activate the emergency response plan, right, the nurses, you're going to be put on team A or team B during the hurricane or after the hurricane, right? You know when you're coming, okay? So activating that emergency response, nurses, you already know what you're gonna do. Come and going, staying, okay? All the housekeeping, every department knows what to do. It's what we prep for, okay? Surgery knows what to do. So all I do is activate one plan. Everybody in the hospital knows what to do. Every hospital will have an emergency response plan. Kitchen knows what to do. Housekeeping knows what to do. OR knows what to do. Nursing, every nursing floor and department knows what to do. Okay. So again, this is a good example of a global response. One answer does all of the rest. We love these types of questions. Okay. And so again, level 4 questions require you to interpret a lot of information. So these are the ones that we strive to always get right. So let's do one type of question, okay? The nurse obtains some water for the client after observing which of the following data? Respiratory ranges from 16 to 18. Breath sounds are clear bilaterally. The client has had no hemoptysis. Gag and swallow reflexes have what? Returned. So when would you get water for a patient? Okay. Good. Okay. So again, gag and swallow reflexes have what? Returned. Okay. So again, before we offer food or fluid to a client, right, especially if they've had a bronchoscopy, anything that went down their throat, any scopes, right, you have to ensure that the gag and swallow reflexes have what? Returned. And let's step it up a bit. Which cranial nerve concerns the gag reflex? Good. All right. Okay. Number 9. Number 9. Okay. right? That glossopharyngeal, right? Innervates that oral pharynx, right? Now, this is important, right? You need to make sure, again, that's why this is basics in health assessment. You need to make sure you have a firm grasp of all your cranial nerves. 100% on boards, you're going to get them. 1 through 12, don't know which one, don't know which way, but you can see how this could have asked you that. Could have been select all that apply. Okay, so you want to cover all your bases. So let's do another example. A client with gastroesophageal reflux disease has just undergone an esophagogastroscopy. Which of the following data is the nurse's highest priority for continued monitoring? Inability to swallow saliva, a temp of 99.4 degrees orally. The client reports heartburn. The client reports a sore throat. Good, ABCs, right? So I have to look at this. Highest priority, no problem, okay? So of course, I'll make sure we're gonna wrap up and this will be the last one. And then I'll record a part 2 so that way you guys can have it because I think you guys are really benefiting from this, okay? So I look at highest priority is airway, breathing, circulation. Remember I told you that's the case scenario, patient has GERD, they just came back from being scoped. You remember, it's very specific. When you see test questions, when it's specific, it didn't just tell you any type of scope. They told you they went where? The esophagus, okay? And the patient has GERD. And it's very important because heartburn, is that an expected finding of GERD or unexpected? Do I expect patients with heartburn with GERD to have heartburn? Yes. So remember, don't fall for the traps. You have to know when you study conditions, expected versus unexpected. I'm not going to worry about something I already know they have. It's part of their condition. Okay. Now, some of you might have think, okay, low grade temp, sore throat. It's the inability to swallow. Why does that worry me? Okay. That throat was what? Anesthetized. Gag and swallow reflexes are temporarily lost due to any endoscopy procedure. Okay, so if they can't swallow, that's a big problem. That means that what? The anesthesia hasn't what? Worn off. They can aspirate if I give them anything. Do I expect it to hurt a little bit after they just put a tube down your throat? Yeah, just a little bit. It's going to be sore, right? This is testing your ability to know what happens after a procedure. What do I look for? This is the critical thinking where you put 1, 2, and 3 together. Okay? Make sense? Okay, good. Okay, so our time together is up, it looks like. Okay, hopefully you guys all enjoyed our time together and you can see how all of this is important every single day. Okay, so I'll probably record a part 2 because I still want to go over some things. And then tonight at 8, just to accommodate a lot of the people who are at clinicals. Oh, it's my pleasure. Again, this is just all for you guys, making sure that you incorporate test taking strategies. Remember what I said, content and test taking strategies. That's how you win. Okay. So you guys have a great day. I'll see those who can come at 9. And then of course, I'll be posting this on the YouTube so that way you guys can have it. Okay. Yeah, it'll be on YouTube. They want me to create some type of channel that everybody can answer and access. So I'll be posting it on the channel. At the end of this, you'll be getting a little survey and it'll have that channel on there for you just to make sure, because I'll be covering everything for you guys. Okay. All right. Have a good one. See those who are coming at 8. If not, have a great weekend. Keep going. Stay encouraged.